Meningoencephalomyelitis possibility due to Mycoplasma pneumoniae. Definition: meningoencephalomyelitis is an infection or inflammation of the meninges and encephalitis, which is an infection or inflammation of the brain. Signs and symptoms: meningoencephalitis. Headache, fever, stiff neck, mental status, photophobia, chills, night sweats, nausea, vomiting, dizziness, position while change. Application in nursing. The nurse responsibility of monitoring vital signs. Comprehensive care will the patient while in the hospital. For administering medication prescribed by the doctor. Physiological support provided to the patient and family. Bacterial meningitis. Video.
Results in the inflammation of the protective membranes that envelop the brain and spinal cord due to a bacterial cause. Some of the bacteria that can cause bacterial meningitis include Streptococcus pneumonia, Neisseria meningitidis, and Listeria monocytogenes. And they can cause signs and symptoms such as vomiting, confusion, and headaches, a stiff neck, seizures, hearing loss, difficulty seeing, and a coma.
Other video: meningitis encephalitis. Other video: Mycoplasma pneumoniae. What is Mycoplasma infection? Mycoplasma infection is a respiratory disease caused by Mycoplasma pneumoniae, a microscopic organism related to bacteria. Who gets Mycoplasma infection? Anyone can get the disease, but most often older children and young adults. Mycoplasma pneumoniae. When Mycoplasma infection occurs, Mycoplasma infection occurs through the year, collective, widespread outbreaks in intervals of 4 to 8 years may occur. Mycoplasma infection is more common in late summer and fall. Signs and symptoms. What are the symptoms of Mycoplasma infection? Typical symptoms include fever, cough, bronchitis, sore throat, headache, and tardiness. A common result of Mycoplasma infection is pneumonia, which is usually mild and rarely requires hospitalization. It may also occur middle ear infection. Symptoms may persist for a few days to over a month. Other video.
Hi, my name is Alexandra March. I'm with Joshua Bailey, and tonight I'm going to talk about the disease Mycoplasma pneumoniae, also known as water pneumonia. It has an interesting morphology to it. It's a spherical or ovoid shape, so it doesn't really fall under the traditional shapes of a lot of bacteria.
The organism is very unique in that it lacks a cell wall and does not need a host cell for replication. It has a remarkable motility due to its filamentous tips that allow it to burrow between the cilia within the respiratory epithelium, or
How soon after exposure do symptoms appear? In general, the symptoms begin between 15 and 25 days after exposure. Symptoms usually develop slowly over a period of 2 to 4 days. How is Mycoplasma infection diagnosed? Mycoplasma infection is usually diagnosed based on typical symptoms and analysis of non-specific blood is helpful for definitive diagnosis, but it is not always positive. The use of more specific laboratory tests is often limited to special outbreak investigation. Other video Mycoplasma pneumoniae insult applied in Ecuador. The length of stay of patient in the stabilization hospital is an average 15.5 days. The months the highest number of cases were reported hospitalized. It is from January to May. In this period was recorded 50.9% of hospital cases of 211. Pros and cons. Pros. It is a disease that if treated early in a medical unit, the risk decreases. Cons. If these conditions do not get the medical treatment, the patient's life is younger. Conclusion. It is a very dangerous disease which have to make a comprehensive assessment patient presenting this disease to prevent further deterioration here. Here, personnel must use as protective safety barriers to prevent contagion. And the exposition.